Hey guys, welcome back. Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis. And in this video, I'm going to basically pick up where I left off on the last video, where I was talking about the conventional treatment and I was comparing it to a functional medicine treatment model. And today I'm going to take a very specific case study. So we're going to look at a type 2 diabetic male, and I'm going to compare the treatment that he was receiving before he came into my office. We're going to talk about why he came into the office, and then I'm going to go through my approach and what I recommended for him. And then we actually went through some of the testing with him this week, and I'll go through some of those results of what we found and how that's significant to him actually getting better and improving his health. So this is, as I said, a type 2 diabetic male, 70-year-old male. He'd been diagnosed 15 years ago, so he'd been living with this disease for quite some time. And what he noticed over the years is that his medication list was growing. He was at the point where he was on 4 blood sugar medications when he came into my office, and that's he had progressed to the point where he was on insulin as well. So he wasn't happy about that. He didn't like injecting himself. And more importantly, he noticed that his numbers, his hemoglobin A1C and his blood sugar continued to go up over the years. And when he would go in to see his doctor, typically the recommendation would be that they would increase his insulin dose. And so he wasn't happy about that. He was also starting to see complications of this disease. So what his goal was he wanted to try to reduce and possibly eliminate some of these medications, get healthier without the need for medication. He was not only on blood sugar medication, but also on blood pressure medication and cholesterol lowering medication as well. So 3 blood pressure, 1 cholesterol. So total, he was on 8 prescription medications when he came in. And, and as I said, low energy, he was gaining weight. He was seeing complications, which he was unhappy with, which is why he came into our office, because he wasn't happy with that model. He didn't feel like over time his health was improving, and so he came into our office. And now I'm going to talk about some of the tests. I'm going to go through some of the things that I found on the tests that I ordered, and some of the things that is different in our model of care, the functional medicine model of care, and we'll discuss that more in depth. Alright guys, so as I talked about in the last video, in the functional medicine model, one of the things that we're always asking is, we're asking, why is this happening? So for this individual that I talked about and mentioned, so he's a type 2 diabetic, he has high sugar. So my question is, okay, why are the sugars high? Why does he have high blood pressure? Why does he have high cholesterol? What's behind that? What's actually causing that? And so I ran and ordered some comprehensive testing. The testing that I ran it through blood, I ran it through saliva, and I also did some of it through urine. And the testing came back, analyzed all the tests, and what we found was, we actually found what was at the root and what was causing these issues. And now we know what we need to fix. So I'm going to go through with you exactly what the findings showed. I'm not going to go over the exact test, but I want to just kind of give you an idea of the things that we look at in the functional medicine model that your doctor should be looking at if you actually want to get control of your health and actually treat the root causes instead of just treating symptoms. So one of the things that we found, so we looked at the liver. This is a common issue with type 2 diabetics. They come in with a fatty liver, dysfunctional liver, and that's going to play a role in blood sugar regulation. So we know that we need to address that, and we need to get his liver functioning better. We also saw food sensitivities. So I did a food panel, and I looked at reactions. So this gentleman's reactions to certain foods that he was ingesting. One of the things that I saw, one of the categories of food with him specifically was dairy. Dairy was highly inflammatory, and he was very, very sensitive to dairy. So we know that that's something that we're going to have to eliminate and take out of his diet. Could be just temporary. Some of these changes may be permanent. I also mentioned here inflammation. So food was causing inflammation. His inflammatory markers were very high, and so we have systemic inflammation in the body. Part of that was the food sensitivities, but one of the other things that I looked at and I feel is important to look for are infections in the body. So there's bacterial infections, fungal infections, viruses that can create inflammation and create stress on the body. So it's important that we, number one, identify them and then treat them and eliminate them to take stress off the body, because that infection is going to create inflammation, and then that inflammation will cause sugars to go up. I also looked at certain nutritional deficiencies. This is something I see that many of the patients coming in, they're not being tested for these nutritional deficiencies. And especially this gentleman, he's on 8 prescription medications. One of the common side effects to many prescription medications is they're going to rob and deplete the body of certain nutrients. And if you start robbing the body of those nutrients, you become deficient. That can make certain conditions worse. So we identified nutritional deficiencies, so that's going to be something that we're going to have to incorporate into his program and into his plan. I also looked at detoxification pathways. So we know that there's liver issues, which is one of the main detoxification organs. We also looked at certain detoxification pathways and noticed that he was not detoxifying well. And some of the research out there shows that when toxins cannot be eliminated properly and you have dysfunction in the detoxification pathways and toxins start to accumulate and build up in the body, it's going to affect insulin resistance. It's going to create more insulin resistance, the increased toxicity, and then of course that's going to affect your ability to regulate sugars. So that's why that's important in this gentleman's program, is to get those detoxification pathways improved. The other thing I noticed was hormonal imbalances. So we want to make sure that hormones are balanced. That can play a part in some of the symptoms that he was experiencing. So we need to address that and incorporate that into his functional medicine plan. I also looked at his adrenal gland function. So adrenal glands, they're 2 little almond-sized glands. They sit on top of the kidneys, and we measured cortisol and we measured some other hormones, and we noticed that his adrenal glands were dysfunctional. Cortisol is going to have an effect on blood sugar, and it could be responding to, as we talked about earlier, the infection that he has in his body. He actually had multiple infections revealed by the testing. So, I want to just go over this case with you to demonstrate a functional medicine approach to treating a condition like type 2 diabetes. So it's looking at the entire body and looking at how all these different parts are functioning and assessing for that individual where the dysfunction is and what's actually causing the high sugars in this case. And then we can start improving function, and as we improve function, we see that the numbers start coming down and we can start seeing improvement in the person's health. So I hope you guys got some valuable information from this video, and if you did, just share it with your friends. I'd appreciate that. If you have a question or comment, go ahead and leave that below, or if you have an idea for a future video, that would be awesome. And if you did get some good information, go ahead and hit the thumbs up button below, and we'll see you in the next video.